And we know the police is doing so.
The Ministry of Health has addressed comprehensive strategies to contain the COVID-19 pandemic in Uganda. This comes after the President of Uganda, Yoweri Kaguta Museveni, issued 23 guidelines of combating the imported virus, which includes the recent lockdown. Since January 2020, 2,661 travelers have been identified for either self or institutional quarantine. Currently, 1,015 are under institutional quarantine. Due to an oversight, many of the travelers had already interacted with communities, which forced the ministry to change strategy from prevention of importation to defeat the spread of the virus.
We know from evidence across other countries, Japan, South Korea, and others, that extreme social distancing is an effective intervention to interrupt transmission and keep other uninfected members of the society healthy.
The ministry was also forced to trace contacts of the relatives of the victims who tested positive to perform a mandatory test. So far, 766 contacts are being followed up.
The suspected cases will be advised to remain in self-quarantine until lab results return.
Although the patients presented mild symptoms, government wants each confirmed case to affect less than one person in the community by avoiding secondary transmission.
People with COVID-19-like symptoms are advised to call their respective district health officers and district surveillance focal persons.
Ministry of Health has decentralized regional referral hospitals and designated health centers to manage the COVID-19 cases.
Mild and moderate cases will be managed at the district level, while severe and critical cases, like those requiring oxygen therapy or intensive care units, will be referred to the regional referral hospitals.
Meanwhile, health workers will continue offering immunization, vaccinations, HIV/AIDS-related services following the recent standard operation procedures. Transportation within the era of lockdown will be treated accordingly by the respective district health officers, resident district commissioners, and Kampala Capital City Authority within Kampala.
And women and children are especially vulnerable. All other services will continue as usual. Patients are free to access medical services during this time by boarding the available vehicles pre-positioned by the districts or KCCA, or use of personal vehicles after obtaining clearance. Pregnant women are especially advised to deliver in health facilities. Kampala Capital City Authority and the district health officers have been advised to ensure pregnant women are given priority access to available vehicles pre-positioned for transportation to the facilities.
To date, the total number of COVID-19 cases is clocking to 10 million, with over 49,000 deaths worldwide. Daniel Mugoya, UBC News.